Hi, Anthropology 274. This is my project on the development of the coronavirus vaccine and animal testing in relation. Before jumping into my presentation, I want to go over a few of the concepts that I'm going to cover. Animals and their role in lab research. Why a vaccine is essential to combating the pandemic. How animals will help create the COVID-19 vaccine. A look at the leading vaccines and how they were developed using animal test subjects. And then finally, I will relate everything back to our course concepts. Animals and their role in lab research. Around 850,000 warm-blooded animals are used for animal testing purposes a year, whether this be for vaccines. Preclinical research is what they're used for, typically using the models to see if a drug or device works and is safe for human use further. It's kind of like a prior step to make sure that no bad reactions happen on human models. Before experimental drugs undergo clinical trials in humans, scientists must test them in animals. This is kind of a controversial opinion to some. Like if you look at PETA or other organizations that don't agree with animal testing, it may have a different opinion, but most believe that it would be unethical to try new treatments in humans before trying them. One of the reasons why we use animals in the first two phases of vaccines is because if it fails in animals, it's most likely going to fail in human trials. This type of study is considered valuable because infecting people on purpose is not a standard practice. So why rodents and non-human primates for testing? Non-human primates share more than 90% of their genes with humans. This makes them perfect test subjects. And mice can genetically be modified to respond to illnesses. Mice are also crucial to this process of experimentation due to the fact that they are easy to export and house in labs, meaning they can have a lot more mice than a lot of other animals. Despite being small creatures, mice share genetic similarities to humans as well. So why is the vaccine essential to combating the pandemic? Well, COVID-19 is a new virus in which humans lack pre-existing immunity to. There are two possible outcomes of this pandemic when you look at it. It either sweeps through susceptible populations and herd immunity will develop in the survivors. This will decrease the severity of the outbreak, but it will cause a huge number of deaths among the vulnerable. The only long-term solution to this pandemic is the development of an effective vaccine or vaccines. It's the only way to really control it. Before I go into the next little segment, I wanted to give a minor graphic warning. It's not bad, but there is, if you are sensitive to like needles or if you don't want to see the animal treatment process, I have a short little video that's going to play next, and it does show some like needles and a little bit of the process of experimenting on animals. So if that is something you're not comfortable with, go ahead and skip right through it.
Animal testing is a must for any vaccine before it's put to public use. Researchers at Tongji University in Shanghai are using these healthy mice to test some of the latest vaccine samples against the novel coronavirus.
The mouse testing is just a preliminary screening for candidate vaccines. After searching through effective antibodies against the virus, the candidate vaccine will continue onto a toxicology test, which will need larger animals, such as monkeys. That will allow us to gauge the safety of the vaccines before applying for clinical testing.
President Liu said a total of over 100 mice will be needed to perform the testing on Sunday. After being injected, the mice will be labeled and taken care of in labs. To guarantee its objectivity, animal tests with the same vaccine samples are also conducted simultaneously at the Chinese Center for Disease Control and Prevention and National Institutes for Food and Drug Control in Beijing.
This kind of mRNA-based vaccine is one of the most advanced and unique technologies to produce a vaccine. It features a shorter preparation time and higher efficiency.
Generally, a vaccine needs to pass 3 steps of clinical testing. The period of time may last from several months to several years based on the testing period and test patients.
If the animal tests go well, Dr. Li hopes they can begin further clinical trials as early as April. Although people want a cure that ultimately ends the coronavirus epidemic soon, scientists say effective vaccines must undergo rigorous testing before being put to public use.
This video was posted about 9 months ago, so things have updated since then, but I believe this is a really good video that demonstrates what animal testing is and how animal testing is being used in the coronavirus. And it gives a little insight into the phases of animal testing too, which I think is really interesting. The Pfizer vaccine is one of the leading vaccines right now for coronavirus. It's currently about 95% effective. Pfizer began working on this vaccine back in March when coronavirus first came to the United States, or at least was first reported in the United States. Pfizer's confirmed their use of mice and non-human primates for research and development of this vaccine. Although I found more information regarding the trials for the Moderna vaccine, which is the next one I will be talking about. I did find that Pfizer and biotech teamed up to create this vaccine, and it's a little different than most animal trials that we do see regarding vaccinations. They're not waiting for the lengthy tests on animals for this one. They are testing on animals, but they are beginning to test on humans a little bit earlier than they usually do. They're starting to test on humans kind of towards the end of their phase 2, which they usually wait to get into phase 3. This is due to the fact that the vaccine is kind of being rushed to be developed because of its high demand and the need for it to come out soon. Another one of the leading vaccines right now for the coronavirus is the Moderna vaccine. Currently, the Moderna vaccine is 94.5% effective. Early trials conducted on mice were effective for this vaccine. Researchers exposed the mice to the virus and gave them dosages of the vaccine. Mice received 1 or 2 shots of a variety of doses of the Moderna vaccine, including doses considered not strong enough to provoke a protective immune response. Researchers then exposed mice to the virus. It was seemingly effective at the beginning. Testing at this point also suggested that antibodies were needed to block virus from the cells. In July of this year, researchers at Moderna made the discovery that their vaccine was able to clear infection from monkeys' lungs. So they started using non-human primates in around July. Moderna began testing its first round of humans in July as well as while they were testing for the monkeys. One thing I learned while researching this was that they kind of sped the process up a little bit faster than usual for the phase trials, and they started kind of incorporating phase 3 with the end of phase 2, where they were kind of still doing testing on non-human primates and incorporating a round of volunteer humans for testing too. This is because just obviously the vaccine is high demand and it has to be produced really fast. The vaccine that Moderna produced uses a synthetic form of genetic material from the coronavirus and inserts it into the body. Messenger RNA or mRNA wrapped in fat cells helps enter the body's cells, and then mRNA prompts cells to make fragments of the virus and then primes your immune system to attack the coronavirus when it enters your body. Looking at the animal tests and trials, what do we see? In Moderna's tests, we see that animals that were vaccinated were able to clear the virus in a rapid amount of time comparably to the animals that were unvaccinated. In the research that I saw that was most prevalent, they took 24 non-human primates, specifically the rhesus, macaque monkey. They were used by Moderna. They had 8 controls each, so they had 3 different variables. They had the unvaccinated monkeys, they had a low dose of the vaccine, and then 8 of them were also given a high dose, so they had 8 controls. Each animal received 2 shots that were vaccinated 4 weeks apart. A month after the second shot that they took, researchers dripped the coronavirus into their noses, an amount comparable to that found in the airways of infected people. The type of monkey does not become very ill from the coronavirus, but does become infected. And the vaccine did not completely prevent infection that they could see, but it did keep the virus from propagating greatly. The vaccinated animals still had some of the virus within their noses, but significantly less than the unvaccinated animals did. The doctor that was working on it also said that if you get a little infection that is cleared rapidly and doesn't shed very long, it reduces the likelihood of transmission to you. And then segueing to a slight dilemma regarding animal testing that I came upon in my research was that at the beginning of the year, China actually stopped supplying monkeys for testing due to fears of virus transmission. More than 60% of non human primates come from China, so this is a huge problem. Monkeys play a critical role in the development of vaccines such as those for COVID 19. An urgent international cooperation is needed to lift this ban so that more research can happen. The ongoing embargo is now beginning to have serious consequences for research in Europe and the rest of the world. Researchers were warned in September of this problem, and most recently, research has started to slow down due to this issue. And finally, I wanted to connect my presentation back to our class, Anthropology 274. I initially thought of my final project idea back in lecture 8 when we learned about vaccinations. The thought crossed my mind of what animal trials are going on in regards to the ongoing pandemic and the vaccine, because the vaccine is in the news every day, yet I had no clue what was going on in the trials. In lecture 8, we learned about some of the codes and rules that are enforced to help regulate animal testing. And while I was researching this project, I thought it was really interesting because one of the directors of a biomedical ethics unit said that outbreaks and national emergencies often create pressure to suspend rights, standards, or normal rules of ethical conduct. And often the decision to do so seems unwise in retrospect. I thought this was an interesting quote due to the fact that they did start working on humans before the phase 2 trials were out, which is kind of unprecedented. But then again, we are in unprecedented times, so it does make quite a bit of sense. Throughout this course, I feel as if one of the more prevalent ideas is the way that humans use animals for their own personal gain. And while I was researching this project, I felt as if that was a pretty prevalent thing I was noticing. I felt as if animals weren't necessarily being treated as well as I feel like they should be. And it's just sad to me that animals are used for humans' gain and those animals don't really get a say in it. They just are kind of born or forced into this system. Yet, I do understand how important animal testing is to humans and for vaccines. And that's through the process of like de-animalizing these humans, which we also learned about in lecture 8. It helps people to maneuver around the idea of animal testing. Anyways, that was my project on coronavirus and the use of animals for the vaccine. And yeah, I hope you guys enjoyed. Thank you for listening.